Hello, welcome everybody. Today I'm going to present our last project about ammonium quantification in human plasma by NMR for staging of liver fibrosis. This project has been done in collaboration with some partners from IBEC and hospital clinic as well. So, as a brief introduction, liver disease is an illness where excess fat builds up in the liver. Pathological conditions such as liver dysfunction may disrupt the urea cycle metabolism and leads to a life-threatening increase of blood. This disease is caused by alcohol, diet, among others. The physiological concentration of ammonium in blood is about 40 micromolar. So nowadays, biopsy is the only technique for an unequivocal diagnosis of liver disease, but it's invasive and painful. So with this project, ammonium quantification is possible with proton NMR, and therefore the liver disease staging. As I said, in healthy subjects, the ammonium concentration is about 40 micromolar, but this concentration can be increased until 250 or even 300. With NMR, we've seen that the dynamic range is quite wide. Therefore, enzymatic assays have some limitation, and the dynamic range is quite limited. So this is the first time measuring ammonium in biofluids using NMR. So an introduction of NMR, we can think in a hydrogen atom that has a magnetic moment and a spin mallory associated. So this makes them behave like a magnet, we could say. So if we apply an external magnetic field, in this case worth 10^4 Tesla, these hydrogen atoms can be split into two different energetic states, the alpha and beta, or the lower energetic state and the higher energetic state. The higher the external field, the higher the energetic gap between both states, and the higher the signal. So actually what we measure is this difference between both states, or we would say that this is like the average. So this is the aim of the project. We started with the plasma obtaintion, then we did the proper sample treatment to achieve an accurate quantification using proton NMR, and finally the data interpretation for the diagnostic stage. This was the protocol development. We optimized some variables such as the deuterated solvent and the pH as well. We saw that the deuterated DMSO was the best solvent so far because it makes the peak narrower, and also the proton-deuterium exchange is avoided with between the solvent and the sample. Also, we saw that the lower the pH, the higher the SNR, and the lower the fluid at half maximum. At the bottom of the slide, we have an scheme of the sample treatment we did. We started with the plasma, then we did the proper like acidification with TFA. We removed the supernatant, and then we lyophilized it. We added the DMSO, and finally the internal standard for the proper quantification. We obtained some samples from a hospital clinic. They gave us some advanced stage alcoholic and non-alcoholic liver disease, and also early stage for both non-alcoholic and alcoholic fatty liver disease. So these stages were like done with biopsy. We saw that for advanced stage for both alcoholic and non-alcoholic, the concentration of ammonium was around 200, while in the early stage were around 100 micromolar. So this is like quite higher compared with the 40 micromolar in healthy subjects. We also compared this quantification with other biochemical assays, such as platelets and international normalized ratio, which is like R2 biochemical assays in order to see which is the coagulation of the blood. So we saw that they have a direct correlation with ammonium. To summarize our project, we saw that this is the first methodology to quantify ammonium in biological samples with a wide dynamic range. And also, this is like a non-invasive technique to discern between early stage and advanced stage of liver fibrosis.